Kobe, thank you. The flu is spreading across the country, and the latest Centers for Disease Control reports show South Carolina having some of the highest flu activity levels in the country for what health officials are now describing as the super flu. News 2's Emma Charles has been tracking flu activity since the start of the season and joins us in this studio to tell us more about this. Emma, we were talking about this off camera. It seems everyone knows someone who's been diagnosed with flu this season.
And they have it pretty bad, Carolyn. Nobody wants this disease. It makes you really sick, but it seems like everyone we know has the flu right now, and doctors say there's several factors causing the spread. Holiday travel, more people indoors, and this new strain of the flu is a big contributing factor.
Flu cases are rising across the country and especially in South Carolina. Doctors say part of the reason is this new variant of influenza A, causing spikes earlier in the season than previous years. While it is not more harmful, it is causing a surge.
It's got some unique mutations that do make it able to escape prior immunity a little bit better. So we are seeing kind of some drift in terms of the nature of the genetics of it that are making it a little bit more severe.
Children and senior citizens are the most vulnerable groups and more likely to be symptomatic and need care. But the good news is data has shown the vaccine can still help curb symptoms.
I think there's some misinformation around because the strain is new that the vaccine can't help you. But we've got good evidence that this vaccine is our best strategy to prevent you from having severe illness or complications from influenza. So it's recommended for everyone 6 months and above who can safely receive it.
The Medical University of South Carolina said hospitalizations from the flu this week have almost doubled since the week prior, and they expect that trend to continue. The South Carolina Department of Health showing a spike in cases over the holidays, with close to 6,000 cases from its latest report, close to 1,500 hospitalizations so far this year in the state, and 735 of those hospitalizations reported just last week.
You're seeing more illness and more in terms of influenza-like illness activity, but also more severe illness in terms of hospitalizations, increasing and at an earlier point in time in the season than we often do.
Some hospitals in the upstate and Grand Strand are limiting visitors to curb the spread. MUSC says the hospital isn't changing any policies right now, but some patients are choosing to limit visits from young children. And they encourage their frontline medical professionals to mask up and get vaccinated. Doctors say to pay attention to symptoms and stay home if you're sick.
With influenza A, what we're seeing most commonly are this combination of high fevers, headache, and body aches as kind of the big symptoms that we look for that kind of clue us in that my problem might be influenza, as opposed to having just runny nose, cough, congestion, more fitting with the common cold.
And doctors say it's never too late to get vaccinated and the best way to prevent severe cases and hospitalization. In studio, I'm Emma Charles. Count on 2.